Hi, my name is Sunny Etheridge, and this is my husband, Charles Etheridge.
Hi. This is my daughter, Ava, and my daughter, Avery.
I found out that I was pregnant I was about a month and a half along. We had went to the doctor, and there was only one baby, one heartbeat. That's all we saw. We went about a month or two later, found out that we were having twins. That was a very big shock to us. Very big shock. We later found out that we were having monodi twins. Monodi twins account for about 30% of twin pregnancies. That's where we have 2 sacs and 1 placenta. It's a high-risk pregnancy, but during the entire pregnancy, we didn't have any problems. The girls flourished, no issues. I continued to work up until I was about 34 weeks pregnant, and I took some time off after that to get ready for the girls. And then we had the girls on August 26th, 2015, here at Southeastern Health.
When I found out we were having twins, honestly, I was so much in shock that my brain went toast there for a little while, because I wasn't expecting to hear that. But that quickly wore away, and I was nervous about it. Everything we had planned up to that point involved a child, but I quickly acclimated to the fact that I was fixing to be the father of twins, and I've never looked back.
Whenever I gave birth here at Southeastern Health, my daughters were 36 weeks, 3 days. It was a scheduled C-section. They had done well during my pregnancy, and we had not expected any kind of NICU time, any kind of extended stay here. During my delivery in the C-section room, Ava went to respiratory distress, and Avery was a little bit smaller than what we had expected at the time, and she had hypoglycemia, which is common with twin births and with small babies. Ava was whisked off to the NICU to be taken care of. I saw Avery, and the rest was history as far as that day. It was a great day. I rested. They stayed in the NICU, and the nurses and doctors took very good care of them at the time. And it was a very great experience at that particular time. Care here at Southeastern Health was absolutely phenomenal in the NICU. Our nurses took care of our girls like they were their own children. Every time we went in, we were always welcomed. We took care of them in the NICU. The nurses allowed us to do anything we needed to do for them. They treated them like they were their own children. The doctors were great, absolutely phenomenal. Every part of the staff, respiratory therapist, physical therapist, lactation consultant, everything was just perfect. Considering we were first-time parents, we were scared. Nothing could prepare you to be a first-time parent, especially to twins. It was an honor to have so many, great nurses working with us. I didn't expect anything less working here at Southeastern Health. It was an honor to call them colleagues, but also call them friends. It made our stressful stay that it could have been a lot worse. It made it so much better. It was great.
I fell in love with the people that helped us. I mean, it was just like family was coming to visit, but it was our caregivers, the doctors, the nurses, everybody involved. You would think they were doing it for free. And we will never forget that.
Ava when she was born, she was 6 pounds, 7 ounces. As of December, she was 13 pounds, 13 ounces. So Ava's doing great. Ava's hitting every milestone that a regular 5-month-old would hit. She's rolling. She's trying to crawl. She talks constantly. She's doing fabulous. And Avery, she was born 4 pounds, 1.5 ounces. And as of December, she was 10 pounds, 9 ounces. So she's really growing, eats like a horse. She rolls around just playing, and she loves to interact with everybody. I think that their stay at the NICU, I think it helped actually with their personalities, because they got used to being around so many different people, and they were loved so much, and they love people. They love smiling at people. They're very adaptable, and I think the stay here at Southeastern Health made us better parents. We were able to go home We knew what to do to take care of our children. We knew that if we had any questions, the nurses here would have answered them. They offered for us to call them if we ever had any questions, any concerns, and a couple of times we did, and it helped so much. It's absolutely great. They're thriving. They're regular babies, and we appreciate every single person that took care of our children and who looked out for us, from my floor that I work on here at Southeastern Health to the people in labor and delivery and the NICU. We greatly appreciate everything that this hospital has done for us.
What's new is Southeastern has had a normal newborn nursery with a little bit of expanded service to sick infants. Most of the times those babies were transferred out of the hospital, and now we are bringing in all new equipment, all new ventilators. We're training all the staff, we're training the nurses, we're training respiratory therapists and all other ancillary staff to bring in a level 2 neonatal intensive care unit. We'll be able to care for babies that are born 8 to 10 weeks early, around 3 pounds, and they'll be able to stay here in their own community. Their parents will be able to visit them anytime they want, and will be babies that maybe need more care than we're able to provide. We have a partnership with Wilmington, New Hanover, and they'll be transferred to New Hanover until they're well enough to come back and finish their care here at Southeastern. Our team currently consists of 3 neonatologists, 1 pediatric intensivist, 2 neonatal nurse practitioners, and we have 14 nurses who are going through extensive training at Wilmington, at New Hanover, in their level 3 neonatal intensive care unit. We're also training the respiratory therapists. We're training a core group of 6 to be responsible to attend all high-risk deliveries and manage ventilators and respiratory emergencies in the intensive care unit. We also have occupational and physical therapists that we are specializing, that they're going to New Hanover also to get training in premature babies and sick babies. We have lactation consultants. We have 2 currently, and they'll be also going down to New Hanover for training to help assist mothers who are breastfeeding preterm babies. It's a little bit different. Our pharmacists here have had some training at New Hanover also, so they have, we've kind of regulated the medications that we're going to give that are safe for babies, for preterm babies. We're excited because in the past, all babies have been separated from their parents, and they'll be able to stay here, and they'll be able to get state-of-the-art care here in the town where the parents are. We have a family-centered care approach where we involve the parents in every decision with their child, and encourage them to be here 24/7. We're open 24/7. We do skin-to-skin care starting in labor and delivery rooms now. As soon as babies are born, even preterm babies can go skin-to-skin. We'll monitor them while they're doing that. And we've bought special rockers and special chairs and recliners to go by each baby's bed so that parents can hold their babies skin-to-skin or as long as they want to. It's very beneficial to the patient. It's very beneficial to the parents. And that completes the neonatal intensive care team.